Ersman is the Director of Research Data Governance at the American Society of Clinical Oncology's Center for Research and Analytics, where he works on strategies and protocol development for the utilization of ASCO's data assets by internal and external researchers. And then along with Jeanette Merrill, he co-leads the Society's Sexual and Gender Minority Task Force to address disparities among LGBT plus oncology workforce and patients with cancer. Jeanette Merrill is the Director of Policy Programs at the American Society of Clinical Oncology and provides programmatic and strategic oversight to the Society's initiatives related to cancer care delivery and research, with a focus on initiatives related to cancer prevention, health equity, and survivorship. And this includes working closely with members to develop and execute strategic projects to relevant organizational communities. So with that, I will turn it over to our presenters.
Great. Thanks so much, Dr. Quinn. Jeanette and I are really thrilled and honored to be here today to talk about the American Society of Clinical Oncology, or ASCO, and our commitment to equity, diversity, and inclusion, the fact that it's a long-standing commitment, and to do a deeper dive into our LGBT plus initiatives. But beyond our bios, Jeanette and I wanted to share a little something about our own commitment in doing this work. I identify as a gay man over 50. I have a background in sociology, so understanding context has always been really important to me, especially understanding the historic underpinnings of present-day situations. I want to share a few thoughts about what has shaped my own views and interactions with the healthcare system. So a little bit of context. For me, I was born in 1970 at a time when being gay or homosexuality was considered a mental disorder, according to the Diagnostic and Statistical Manual, or DSM, of that time. In the 80s, I was in my teens, coming of age. We saw the emergence of HIV/AIDS, and the fact that there were nearly 20,000 primarily gay and bisexual men who died before the federal government even acknowledged it. In the 90s, I had my first solo interactions with the healthcare system. I was petrified. Who do I go to? How do I come out? Will I be safe? It took me a long time before I really started to feel safe and be truly open with my providers. So when I think about this presentation in cancer care and treatment outcomes, I think about the importance of looking at context and spending time to understand how people's identities intersect and shape their interactions with providers in the healthcare system. I feel privileged to be able to work on these issues and to share what ASCO is doing in this area. Now, Jeanette wanted to share a few of her thoughts.
Thanks, Steve. Recently, there was a thing floating around Twitter that begged the question of who would play your parents in your biopic. And my answer to that question would be Rock Hudson and Doris Day. You can draw some very obvious conclusions from that, but it's as the daughter of a gay man witnessing the impact of stigma and a resulting delayed diagnosis, delayed care being sought for that diagnosis, and potentially contributions of clinician bias that resulted in a loved one no longer being here today. And it is with that drive to do better that I find myself very fortunate to work with Steve and an organization that also wants to do better, that we have been able to move some work forward that we're very glad to share with you today. And Steve, with that, I'll turn it back to you.
Great, thanks, Jeanette. Neither of us have any financial disclosures to report. So our learning objectives for today are twofold. We want to provide sort of a global overview of ASCO's commitment to equity, diversity, and inclusion, talk about the fact that it's long-standing, and then to do a deep dive into ASCO's activities, resources, and opportunities to promote equity among the LGBT oncology workforce, people with cancer, as well as ASCO staff. So now I'm going to tell you a little bit about who we are and our commitment to equity, diversity, and inclusion. So for those of you who do not know, ASCO is the world's leading professional organization for physicians and oncology professionals. We're a nonprofit founded in 1964. We have a global membership of nearly 45,000 oncology professionals, roughly divided between our domestic and international members. Oncology professionals practice in large and small academic and community-based settings, including clinical physicians, researchers, patient advocates, nurses, administrators, among others who are leaders in advancing cancer care. So throughout our talk today, we're going to talk about a number of resources and opportunities for engagement, and I wanted to highlight a couple of those up front. The first is cancer.net. This is a website that provides patients, families, and the general public with oncologist-vetted and approved information on nearly 120 forms of cancer. And under our ASCO umbrella, we also have a nonprofit that was established in 1999 by ASCO called Conquer Cancer, the ASCO Foundation. As the philanthropic affiliate of ASCO, Conquer Cancer is charged with raising funds for its grants and awards and many of the initiatives that are currently going on at ASCO. Conquer Cancer's Grants and Awards program is one of the largest among professional societies, with more than $135 million in funding awarded through more than 2,200 grants and awards in 77 countries since its inception. So ASCO has a long-standing commitment to cancer care equity, and it has been a high priority for the society since its founding in 1964. Among ASCO's 7 physician founders was Dr. Jane C. Wright, Black oncologist, surgeon, and researcher, who served at a time when both oncology and the civil rights movement were much less developed. We can see her imprint on ASCO throughout the organization's efforts in inclusivity and equity in cancer care. So from our founding, assuring high quality and equitable care for every patient with cancer has been at the core of ASCO's mission. So ASCO's longstanding commitment to EDI is supported by our 3 mission pillars. The first is education. Education that includes creating a shared knowledge base, educational resources related to inequities in the oncology community, with one important focus being on workforce diversity, including developing a workforce that represents the population at large and is equipped to care for disparate populations. Quality is our second mission pillar, with a focus on quality assessment and improvement initiatives to facilitate the reduction of disparities in cancer care and treatment outcomes. This includes the development of policies and advocating for policies that ensure access to high quality, equitable cancer care. Our third pillar is research. This includes the development of an evidence base with a focus on cancer care disparities and representation in clinical trials. One area to highlight here is Conquer Cancer Research Awards, which includes funding through grants for investigators of underrepresented groups and for investigators focused on disparities research. I want to call out here that just this past summer, the Society's Board of Directors added equity to ASCO's mission statement, which now reads, "Conquering cancer through research, education, and promotion of highest quality, equitable patient care." This really was to call out attention to the importance of equity and inclusivity in the work that ASCO does. So in order to achieve real impact, we really need to focus on all 3 of these: diversity, equity, and inclusion. By diversity, we're respecting individual differences and making sure that we have representation of diverse oncology voices. Equity, we're creating fair and just opportunities in our policies, our practices, and our position statements. And inclusion, that includes representation in positions of power, and that diverse oncology voices are represented, and our organizational culture reflects this inclusivity. Just this past summer, in August, ASCO issued a new policy statement on health equity, calling for bolder, more aggressive steps to achieve equity for all patients. ASCO's policy statement includes recommendations that not only are intended to guide the work of ASCO, but also our other stakeholders, including medical training programs, health systems, payers, policymakers, and researchers. The recommendations fall into 4 main areas and comprise the goals of the strategic plan. The first goal is a focus on addressing structural barriers. So at a high level, most oncology professionals and healthcare professionals in general can see that inequity in healthcare is steeped in long-standing institutional and systemic bias, racism, and social injustice. So a component of this effort is to address structural barriers to create a more diverse workforce to ensure physicians represent the patients they treat. The second goal of the statement is focused on increasing awareness and action. This includes increased engagement with members, patient advocates, local governments, academia, local governments, health systems, and payers to not only raise awareness, but to develop meaningful collaborations focused on eliminating inequities in cancer care. The third goal of the statement is focused on ensuring equitable access to high quality care. The Society has worked for years to help practices in underserved communities to improve the quality of care that they offer, and have funded a number of different grant opportunities for practices to participate in quality improvement initiatives, such as the Quality Oncology Practice Initiative, also known as COPI. And ASCO is taking these steps even further by charging its effectively serving the underserved task force with developing and executing a strategy to identify and understand the needs of providers who deliver care for underserved populations and communities to improve access and the quality of care. So the fourth goal is ensuring equitable access to research. The final goal is that cancer research fully reflects the diversity of patients affected by cancer, with specific attention being directed to underrepresented communities. So ASCO seeks to do this in a number of different ways, and among them is to fund research in this area. So again, Conquer Cancer offers several grants for underrepresented populations in medicine for both individuals from transition from fellowship to faculty and investigators in their first faculty appointment. So this slide here shows several of our current projects and initiatives around our three pillars of research, education, and quality. These are ongoing, and we hope that collectively they'll really move the needle related to equity, diversity, and inclusion. So our commitment to address health disparities, inequities, and critical gaps in care is longstanding, but it's particularly highlighted by this year's 2021 presidential theme selected by this year's president, Dr. Lori Pierce, a radiation oncologist. The theme calls for the oncology community to confront and address the complex forces and systems that have created and perpetuated disparities in cancer care, in treatment, and in research. And as called out by Dr. Pierce, the mission of creating health equity is firmly embedded in ASCO, and we will continue to address these issues. This is not a short-term goal. It is something that will require constant attention and constant commitment, and ASCO is all in. So with this slide, I want to point out that the equity, diversity, and inclusion initiatives are not only externally facing, but also internally facing for the support of our staff at ASCO. In 2019, several staff formed a resource group called ASCO LGBT+ Staff and Allies. Here we share resources on cancer care, resources about social injustice.
Steve, we lost your audio. Steve.
I've sent him a text. I don't know if he'll see it pop up though, because I guess he can't hear us.
Jeanette, if you he may not be able to hear it, but you might want to send him a text message like through the phone or call.
I've done that. Yeah, I can call him. Let me see, get his attention.
Yeah, when you're presenting, you're not going to be able to see the chat. You're not paying attention. There we go. You got his attention. me see if what the issue might be here. Looks like he's reconnecting his audio. Yeah, just tell him to, Steve, you're on mute. So I think you're back, but try turning off the mute. No, we
Oh.
cannot hear you. Let me see.
Andrea is saying it's your microphone.
So Steve, can you hear me, my voice, if you can? Okay, so if you want to go down to the microphone in the lower left-hand corner, there's a little widget with an arrow up. You click on that arrow up and you'll see it's under audio settings, or you'll see select a microphone. If you have multiple microphones available, try a different one.
Otherwise, maybe he can call in using his phone, just use the audio on his phone.
Yeah, that's the other way to do it, is you can call in. But actually, I think what you should do, Steve, this has happened before. Believe it or not, if you leave the meeting and you come back in, it may reinitiate your audio correctly. There we go. Okay, let's see. Thank you, everyone, while we enjoy the joys of technology.
Steve and I
wouldn't be a
were, sorry, Anthony.
I'm sorry, I was just going to make a joke. It wouldn't be a global pandemic year without a one Zoom audio issue per meeting.
Steve and I had sort of commiserated how we wished we could be actually in New York City with you all to do this presentation. So
yeah, we wish that as well. And we're hoping that next year will be a different situation, literally a year from now, that we'll all be together again in New York City, back on the Upper East Side.
That would be great.
Jeanette, do you want to jump to your section and then backtrack, or?
I think if it's okay if we could just wait for Steve,
Okay.
because his sort of builds into what I'd share, and it might feel a little disjointed to not have some more of the background information, if that's okay.
Sure.
There he comes. That's what he gets to moving to, 10 acres out in the middle of Rhode Island.
There we go. Let's check your audio. So if you turn off your mute, Steve, let's see if that'll work. I'm not host, Nelson. Thank you.
I just asked him to unmute.
Okay, thank you. Oh dear.
Not,
Still not
I
working.
see your lips moving, but
So
don't
the
hear.
way this can work, Nelson, do you have the phone in? Because Steve can actually call in on their cell phone.
Let me look it up. I think you just enter the meeting ID and password. Let me just, so you can at least enter the meeting ID. He should have that, but I'll type it in the box. Let me just look it up.
So Steve, I'm not sure if you have Zoom on your cell phone. You can join Zoom. If you have the app on your cell phone, that's actually the easiest. But I see you putting headset on. That might actually help.
Hold on, I'm looking up the. Oops. That's the meeting ID and the password. I think he needs the phone number too, right? I think it's a common Zoom number. What's the Zoom phone number?
This room, Nelson, I believe, oh no, it's the secondary room. So I don't know what account this room you're using.
No, I think it's just a common Zoom phone number, right, to call in.
Maybe. Yes, maybe.
Oh, here's the number. We just use that phone number to call in.
So yeah, 646-876-9923. And then you'll enter the meeting ID and the password when you're prompted.
Is he still a co-host that he can share his screen?
I believe so. I'm not a host, so I can't check that. There we go.
Okay.
Screen is shared. Let's see if we have, yes, and we have, and so the phone dial-in person that I think is them, whoever's the host is, can you unmute the phone, the 1401 number?
Yes, I will.
Thank you. We're just trying to unmute you, Steve. There we go. And what you want to do is turn your volume down on your computer. There you go. And then,
Can you hear my voice?
yes, we can.
Yeah.
It's great. Thank you so much for handling that.
Yes, my sincere apologies for that. I don't know exactly what happened. Are you seeing my slides?
We see the
Yeah.
slides and we hear your voice. You can proceed.
Well, sorry about that technical glitch. So what I was saying was that we have our initiatives that are externally facing, but we also have several internally facing initiatives. And they're really to support our staff's growth and development around the areas of EDI. So in 2019, there were several staff who formed a resource group called ASCO LGBT+ Staff and Allies. Here we share research related to cancer care and LGBT populations. We also share various issues related to social justice and other related issues. Just this last year, we saw the formation of an EDI task force, which includes staff from every department and every division across ASCO. They're really charged with guiding, informing, and designing what ASCO is doing internally related to our EDI initiatives for our staff. I really like this next slide. Do we have answers for reaching equity? Of course not. But sometimes it's not about having all the answers, but rather posing the right questions and searching for the answers together. This is a journey. So now, ASCO's LGBT+ initiatives. And first, I want to provide a little bit of context here. So we've seen a growing body of literature and evidence that shows us that certain risk factors are elevated among LGBT+ individuals, including higher rates of smoking, alcohol use, and obesity. And often there's an increased risk over the life course. We see evidence of higher rates starting as early as middle school. And you can see this in CDC's Youth Risk Behavior Surveillance Survey, or the YRBSS. And in 2018, ASCO released a media issue brief focused on reducing disparities in cancer care for sexual and gender minority individuals. It highlights the fact that sexual and gender minority populations face unique challenges in accessing health services, including discrimination and a greater risk of anxiety and depression that can result in disparate care. Also, SGM populations have lower rates of cancer screening for reasons that include lower insurance rates, exclusion from traditional cancer screening campaigns, and previous experiences of discrimination when interacting with healthcare systems and providers. Because early diagnosis and prompt management are paramount in the management of many cancers, SGM patients with cancer may be more likely to seek care when the disease is at a later stage. In a recent health clinic study, cancer screening rates for transgender versus non-transgender patients were 70% lower for breast cancer screening, 60% lower for cervical cancer screening, 50% lower for colon cancer, and nearly a quarter, or 23% of respondents, reported that they did not seek needed health care in the year prior due to fear of being mistreated as a transgender person. This is not okay. In 2017, ASCO issued a position statement on identifying strategies for reducing cancer disparities among sexual and gender minority populations, which was led by ASCO committee members. We vetted it with various stakeholders, and it really calls on ASCO to have a coordinated effort to address cancer-related disparities among the SGM population. And I want to note here that the position statement, as well as our other work, has adopted NIH's definition and use of the term SGM. And our goal is to align with our federal partners, but ultimately we want it to be more inclusive. The position statement includes goals in the areas of patient education and support. Here, strategies identified in the position statement include enhancing patient navigation and care coordination, expanding education for SGM patients with cancer and survivors, increasing patient access to culturally competent support services, and creating safe spaces for SGM patients. The second goal of the position statement is focused on workforce development and diversity. Here, strategies include expanding and promoting cultural competency training, incorporating SGM training into curricula, training requirements, and certification exam content, and fostering safe environments for SGM staff and providers. The third goal of the position statement includes a focus on quality improvement strategies. They include collecting and using SGM relevant data, such as SOGI data for quality improvement, ensuring prompt follow-up and the continuity of care. The third goal of the statement is focused on policy solutions. Here, some of the strategies identified include creating and enforcing policies that ensure access to culturally competent, equitable cancer care, ensuring adequate insurance coverage to meet the needs of SGM individuals affected by cancer, and ensuring policies that prohibit discrimination. And the last goal of the position statement focuses on research strategies. Here, the position statement calls for the promotion of SOGI data collection in cancer registries and clinical trials, promoting research among SGM populations, and providing training for the next generation of oncology researchers. The position statement did receive a fair amount of media coverage and really was broadly disseminated to various ASCO members through our media and communications channels. They were sent out through our ASCO Express, Daily Cancer in the News, State Cancer Affiliate newsletter, Oncology Practice Insider, ASCO in Action, and was picked up by a number of media organizations, including Helio, Cure, Medscape, Oncology Times, Cancer Therapy Advisor, and Hem/Onc Today. So in 2019, we saw the formation of ASCO's Sexual and Gender Minority Task Force. This sits under our Health Equity Committee, and the charge of the task force is really to develop and implement a strategy to advance the recommendations of the 2017 position statement that I just talked about. The goals of the task force include identifying resources that enhance clinician and patient education, improving outreach and support of SGM clinicians and patients, and encouraging research activities and data collection to further our understanding of cancer care among SGM populations. So now I'm going to turn things over to Jeanette.
Thanks, Steve. Next slide, please. As you may have started to realize, ASCO's work really falls under three strategic pillars of being evidence and research, education, and leading into quality. And so as noted, the task force really aligns its work with those broader strategic pillars, and then certainly those areas that were identified more specifically in the 2017 statement. And so that is on development of the evidence base, which I'm going to skip over and have Steve come back in a minute and speak more to the work around SOGI data collection, but certainly increasing education, workforce diversity support, expanding quality of care across the continuum, especially looking at access, and then increasing advocacy. Next slide, please. So that 2017 policy statement did describe specific areas of action, including what you see here around enhancing patient navigation care coordination, expanding education, especially for patients, increasing access to culturally competent supportive services, creating safe spaces within the healthcare system, and increasing prevention education, particularly around those disease sites that disproportionately affect SGM patients. And so in the last couple of years, we've seen an uptick in the amount and availability of specific content. And this is including everything from poster sessions at our annual meeting to live discussions. And Steve is going to report here again in a minute in 2 of the abstracts that will be included in the 2021 meeting, although virtual. And especially looking at continued opportunities to increase awareness, integrate where appropriate, and create individual content. We've seen the task force members specifically author blog posts that are available on our cancer.net website. Next slide, please. Just a little bit more around the workforce diversity and support. In 2017, ASCO did develop and launch a strategic plan around increasing diversity of those who are underrepresented in medicine. That was a little more targeted toward those who are of racial and ethnic minorities. And at the same time, there was a new initiative supporting women in oncology. And in the past year, those 2 efforts have really been combined and expanded. And the task force is working along with that group to make sure that that is inclusive of all of those who identify as women, and also understanding the intersectionality there. The task force has been exploring opportunities to create networking and safe spaces at the annual meeting. We do offer trainee lounges, women in oncology lounges that have some specific mentoring opportunities, again, when we're able to be in person. And so we'll be coming back and hoping to offer that in the 22 meeting. Hopefully, when there are some meetings starting to come back in person in the fall, we will see the implementation and availability of pronoun buttons. And again, Steve is going to speak a little bit more to ASCO's efforts to collect SOGI information from our members and customers. One thing that the task force did explore, and we found that it wasn't really the right outlet, was to create a virtual networking space. And ASCO offers these outlets called My Connection groups. You don't have to be an ASCO member to join that. And so it was really just an opportunity to have a listserv, a place where folks could post messages, find others, and ultimately found it was just one more place to log in, one more email in a very full inbox. And so it really didn't hit the mark. And so certainly, we would love to see comments in the chat box, or when we come to questions at the end, hear from you all how ASCO could better support you, especially if you work in the cancer community, to expand your network. And that can be everything from leveraging the Society's own social media accounts to identify providers that are working particularly in the cancer care space. Next slide, please. ASCO is really aligning all of its existing quality improvement programs around a new cancer care delivery strategy that will be patient-centered. And this will have some new quality standards and measures as it evolves. And so certainly members of the task force are instrumental in informing that, especially once we have that needed evidence base to identify opportunities to develop clinical guidelines around the care of SGM patients, especially for those who may have been on long-term hormone therapy. And really just to make sure that care is delivered in a culturally competent way, and especially that survivors are getting those needed screenings for late and long-term effects. Next slide, please. And lastly, just want to share, ASCO is very active in advocacy efforts at both the state and federal level. The task force itself serves as experts to help inform strategies and identify the opportunities to support and sometimes oppose legislation and regulation that will impact the SGM community. Specifically want to note that ASCO did submit a comment on the proposed rule under the previous administration around their ruling on Section 1557 of the Affordable Care Act, which rolled back protections, particularly for those who are gender minorities. And we also issued a comment letter on the final rule, recognizing that final rules, issuing a comment letter, it's sort of just going in a folder, but the hope was at that time, and this was happening prior to November of 2020, that with a potential new administration who was friendlier, that we could be well positioned as a partner to help engage and undo the damage of that ruling. And certainly looking to collaborate with federal agencies and the regulatory bodies who have the ability to support increased SOGI data collection is an ongoing area of focus. And with that, I'll turn it back to Steve to speak more about that SOGI collection effort.
Great, thank you. Just checking my voice, can you hear?
Yes.
Okay, great. So among the key recommendations of that 2017 position statement is a focus on research and the collection of SOGI data. So there are a number of recent activities, research activities in the area, and we're going to highlight a couple on this slide, but I'll go into a deeper dive in the subsequent slides. The first one is a research survey on the current collection of SOGI data in clinical practice and research. The second is focused on an analysis of cancer-linked data that looks at the retrospective identification of transgender individuals in EHR data. The third is the development of a clinical trials site resource for the collection of SOGI data in clinical trials. And as Jeanette alluded to earlier, as ASCO updates our customer relations management system or CRM system, we will collect full SOGI data along with other demographic data. We'd like to point out here that we're at the very beginning stages of understanding how best to do this. And so we're really going to lean on our sexual and gender minority task force to provide the needed expertise to guide us. So the first research activity I'm going to talk about is the ASCO research survey on SOGI data collection in clinical practice and research. This supports our 2017 position statement, which encourages research activities and data collection to further our understanding of cancer care among SGM populations and works towards improving outreach and support of SGM clinicians and patients, and ultimately to help identify resources and education to increase our awareness. So the survey was administered just this past fall in 2020 to a sample of US ASCO members, as well as a sample via various social media strategies. The survey was designed to help ASCO better understand the barriers and facilitators to the collection of SOGI data, and ultimately to help identify gaps in data collection and care to improve outcomes for SGM patients with cancer. And as Jeanette mentioned, we submitted 2 abstracts to this year's ASCO annual meeting, and both were selected for dissemination. And one will be highlighted in a poster discussion session with 12 other abstracts that have the potential to impact cancer care. And this is in a health services and quality track. So I want to point out that the survey was really widely disseminated. We saw our ASCO communications team outreach through various communication mechanisms, including various social media platforms. We had a reminder coming directly from our ASCO president urging people to participate in this survey. And we also saw a number of our members outreach to their own social networks, urging people to participate in this survey, which we're really pleased about. So another recent study looks at CancerLink EHR data. For those of you who don't know, CancerLink is an online quality improvement platform designed for oncology practices to measure and monitor practice quality indicators. The study was conducted to retrospectively identify transgender identity. And it's interesting how this study came about. We were sitting in a meeting with the CancerLink informatics staff. It was a data quality meeting. And the informatics team presented an issue that they found in the data. There were hundreds of cases that had a gender identity with a discordant diagnosis. So male identity with a diagnosis of ovarian, uterine cancer, or female identity with a diagnosis of prostate or testicular or penile cancer. So the study was conducted to really understand how we might go about identifying transgender individuals within EHR data and to determine whether or not the individuals identified were indeed transgender, or perhaps was it a data entry error. So because gender identity data are not routinely collected in EHRs, the ability to look at cancer prevalence and outcomes data are really limited. So we used 3 criteria for identifying transgender status. The first is ICD-9 and 10 codes that were suggestive of transgender identity. The second criteria focused on male gender with a diagnosis of cervical, endometrial, ovarian, fallopian tube, or other related cancers. And the third criteria looked at female gender with a diagnosis of prostate, testicular, penile, or other related cancers. So charts were abstracted, and we went about the process of trying to confirm transgender identity within those EHR records. So the results of the 557 cases that matched our inclusion criteria, 242 of those were abstracted. We found that 76% of patients with diagnosis codes that were suggestive of transgender identity, we were able to confirm as transgender patients. And only 2 to 3% of people that were identified by the second or third criteria had evidence of being a transgender patient. So what we basically determined is that, retrospectively identifying transgender status within EHRs is really difficult. And with this particular analysis, it probably represents a huge underestimation of the transgender population within the CancerLink data. So what we concluded is that given the need for data regarding transgender people with cancer and deficiencies of current data resources, we really need to have a national concerted effort to prospectively collect gender identity data. And these efforts will really require us to create safe healthcare environments for transgender individuals. So ASCO does have a number of clinical trial resources. One of those is an at-a-glance summary. These typically are 2 pages of best practices, tips, considerations on topics related to conducting and managing clinical trials. So ASCO is developing an at-a-glance summary focused on SOGI data collection in clinical trials. We hope to release this at some point later this year. Clinical trials have not routinely collected sexual orientation and gender identity, nor are these data available in large patient registries. So in order to understand disparities and address inequities in outcomes for SGM patients with cancer, we need to have an evidence-based approach. So SOGI data should be collected as part of clinical trials, and collecting SOGI data and increasing clinical trial access for SGM people will ensure that clinical trial findings are not only relevant, but actionable. And the last research study that I'd like to talk about is a colors feasibility study. You can see the research team on the slide here. ASCO is working with the research team of Colors to conduct a feasibility study under our Sexual and Gender Minority Task Force. And the study is being conducted among a sample of oncology fellows. For those of you who don't know, Colors is an online training program targeting oncologists to better understand the special considerations in providing care for sexual and gender minority patients with cancer. So the overarching objectives of the study are to demonstrate a high level of recruitment and a high level of retention and completion of the Colors training. So they have a long-term goal of leveraging the feasibility data for a potential future grant application to conduct a well-powered randomized clinical trial. With that, I'm going to hand things back over to Jeanette.
Thanks, Steve. It's important to note that this is not Steve and I behind the scenes doing all this work. We are only successful because we are able to take advantage of very active volunteers who contribute immeasurable amounts of time and expertise to develop this work. And so I want to report a little bit more on how you can become involved with ASCO and some further resources that the Society in turn can provide. Next slide, please. So again, we have a number of committees. This work is done under the banner of our Health Equity Committee. And so members self-nominate to serve on these committees. The cutoff is about January of every year. So we've just gone through the process. But if you're interested, I encourage you. And if you are, you have to be a member of ASCO to be on those committees. But you can volunteer through a portal so we know of your interest. In addition to having our standing committees, there's often work that requires a more short-term need. And so we will pull folks from that volunteer core that is available to us. Folks who are interested in getting involved in the advocacy work can join our ACT network, and this will send you notices to send letters off to your state and local officials to help support or oppose certain legislation and regulation. We also have a trainee and early career council that is specifically made up of folks who are early in their career, but help direct the work of ASCO that is focused on that community. We have a number of provider resources available, several online toolkits. One in particular I want to mention is our survivorship compendium that does have, it is currently undergoing an update, but should be relaunched here by the end of May, and has some specific content to SGM communities around their survivorship care. And ASCO also has an active mentorship program. This is a virtual program, year-long program that tends to start and finish with the annual meeting. And generally there are opportunities to come together, especially when we are in person, for folks who are involved in that program. I'm sure of great interest is the opportunities that ASCO offers for research awards. These are done through the Conquer Cancer Foundation. And this is support for all disease sites across all areas, from prevention to treatment and end of life and palliative care. Specifically, there is a Young Investigator Award that is a one-year clinical or translational research project that helps from fellowship, advance from fellowship to a faculty appointment. There is the Career Development Award, and that is funding across 3 years to clinical investigators. The Advanced Clinical Research Award is also a 3-year award to support physician scientists committed to performing original clinical cancer care research that is not currently funded, and it has to have a patient-oriented focus for that one. And lastly, the research professorship is a 5-year grant for full professors to make significant contributions to cancer research, and also who are dedicated to mentoring the next generation of researchers. Next slide, please. Other opportunities include quarterly career discussions. These are virtual discussions designed to specifically support those who are underrepresented in medicine. They are facilitated by oncologists and have various career development topics, included an unwritten guidebook to advancing in medicine and choosing your specialty in oncology, and also support as you go through an interview process. As mentioned, we have a lot of activity associated with our annual meeting when we are in person, and that is for medical students and non-oncology residents to present research as part of an abstract forum. ASCO supports oncology student interest groups at a number of medical schools. And if there's not one at your school and you're interested in engaging with that, we can certainly get you information and provide some help in setting that up. And then lastly, I just want to mention this brand new oncology summer internship, which is set to launch as a pilot program this year. This is a pilot program for rising second-year medical students from populations underrepresented in medicine. And it'll be a 4-week program implemented in the summer break between first and second year of medical school, again, to really share and expose medical students to the oncology field in hopes of drawing them into that as an area of interest. With that, I think we are available for questions.
Thank you so much. That was really interesting. As much as I thought I knew about ASCO, there was many things I learned from looking at it. So there's quite a few questions in the chat. The first one early on was to thank you both for sharing your personal experiences, and noting that all of us need to do that more. It was also asked if you could provide more information or the citation for the trans screening disparities that you had on an earlier slide.
Sure, the study within CancerLink.
CancerLink, okay.
Yeah, it was if I could clarify, it was the one that you quoted all the different disparities in cancer screening based on a survey that was done, a patient survey that was done. I wanted to know what setting that was.
Oh, sure. That was from the LGBT Cancer Network. So that was one of the studies that was discussed on their website. I'll find the specific clinical site for that, but I'm drawing a blank on the top of my head right now what that was.
That's okay. If I know that it's from the LGBT Cancer Network, I can try and find it there too. Thank you.
Great.
Another comment, it says a lot of your outreach efforts are directed towards younger SGM populations through TikTok and Twitter. Are there any efforts specifically targeted towards older SGM populations, particularly elderly trans people who may have higher rates of social isolation and poorer overall health than their cisgender age counterparts?
Thank you for that question. I made a note of it when I saw it pop up in the chat box, because it's definitely an area we probably need to focus more attention on.